This nice lady has a full thickness rotator cuff tear in the supraspinatus, which is about in this area. And I want to show you a test called the empty can test and kind of prove a point that it's a good test, but it's not perfect. So for empty can, I usually have their arm come out like this. So roughly at an angle like this. That's a nice watch too. And so I usually say push up to the ceiling. So she's pushing up and I usually do both sides at the same time. And I'm looking for pain or loss of power. And usually it's here in this area, or they just kind of collapse down. But you know what? You can relax now. The great thing is she's been doing rehab for the last 3 months, and she's doing a great job strengthening all of these muscles and tendons around that injury to take pressure off the injury. So the sensitivity, like how sensitive is that empty can or Job's test? Probably in the mid 80s. And how specific is it? Well, it's not quite as specific. It's probably in the low 60s. One research said 62% if you want to be like specific. But anyway, but notice it's not perfect though, right? So you'll be fooled a lot. So many of these full thickness rotator cuff tests or tears can get better with lots and lots of dedicated rehab and an awesome patient. So a caveat to that is most young people, if they have a full thickness rotator cuff tear, they really should have surgery, generally speaking. Elderly patients, that might be a different story. So this lady's 73 years old, really didn't want surgery. So we thought we'd maximize non-operative management. We did a cortisone injection. She did 3 months rehab. She's actually doing awesome. And she's rock solid when we do that empty can test.